Recently, VETtalk TV was invited to the launch of Bravecto, and we managed to chat with Dr Katrina Warren away from the Wonder Dogs.
Beautiful. It is exciting. It's going to be an absolute game changer for people that live along the coast, particularly of East Coast Australia, where ticks are prevalent, but also for people that travel. So I know with me now, I don't live in a tick area, a traditional tick area, but I travel with Riley all the time up and down the coast, and it's just great to know he's protected for the next few months.
Bravecto Ambassador Dr Katrina has good reason to be enthusiastic about a longer-lasting tick protectant.
Look, I've had so many friends have issues with paralysis ticks. I've had friends who have had their dogs die from paralysis tick, but me personally, I had my beautiful Toby many years ago. Was staying with a friend when I was away for work, and my friend did not give him his tick preventative, and when I picked him up from holiday, basically he collapsed in my arms and he nearly died, and it was absolutely heartbreaking as a pet owner, not from the veterinary side, but as a pet owner, to not know whether my dog was going to make it. He couldn't walk, he was in severe respiratory distress. I'm one of the lucky ones because he did pull through, but every day around the country we know that dogs die from ticks.
It's a much bigger problem than most people realise.
Well, the scale of the problem is huge when you're east of the dividing range. Ticks are carried by their endemic hosts, bandicoots, possums, and other native fauna. And so wherever we've got pockets of native fauna, we get paralysis ticks. And in their own environment, they don't do any damage to those animals. It's when dogs and cats explore those areas and become bitten by the tick that we see severe tick paralysis.
As a specialist emergency vet, Dr Webster has seen more tick patients than most.
If clinical signs are seen, so if your dog or cat has any wobbliness while they're walking, any gagging or retching, or you find a tick on them, you need to get to the vet straight away, because the patient's going to deteriorate over 12 to 24 hours and probably die. So the sooner the better when clinical signs or a tick have been located.
Can you save them at that point?
Yes. We potentially can save patients at any point with treatment with tick anti-serum and life support for respiratory failure and cardiac failure if that occurs, but it's a big undertaking and sometimes takes a lot of intensive care, and it can be quite expensive.
How expensive? Well, vet fees for basic tick treatment can range from $500 to $1,500. However, if the poison has paralysed the pet's ability to breathe and they need to go on a ventilator, you're talking $10,000 to $20,000 more. The number of cases seems odd when you consider that tick treatments have been available for years. Only 4% of owners actually treat fortnightly as they should, whereas more than half treat every 3 months, which means their dog is exposed to paralysis tick. So a product which you only have to give 3 monthly should hit the right buttons. But given you have to wait 2 weeks for most existing tick treatments to take effect, how quickly does Bravecto work?
Now, I'm not a pharmacologist and I don't sell any tick preventatives, but in my opinion it's a generation above. What it does is has a very high level of efficacy, so it'll kill ticks on a pet within 72 hours of attachment. More than 90% of fleas that attach are going to be dead within 8 hours. And with paralysis ticks, 100% will be dead within 72 hours.
And yes, we did have a bit of fun with the Wonder Dogs. Oh, and Bravecto is available from your local vet.